So I have this one.
Okay.
It looks like a claw.
Yeah, it does. Like a lobster claw, you're right.
Yeah. So as it's coming into focus, I kind of, like, when I saw this one, honestly, from far, I was like, well, what is this? Very pink. Didn't really look like skin. Maybe it shouldn't be in this collection. And then when you kind of zoom in, you see this sort of, like, muscular wall to it. That's how I think of it. And then all this good stuff over here, yeah?
Exactly.
So this is good for myiasis, like this ornament-looking thing.
Very good. This is Botfly larva, a maggot of the Botfly or Myiasis, and you get bit by the fly lays its egg in the skin of the patient, and then that hatches and develops into this little wriggly worm that is normally this larva. It's not really a worm. I misspoke. It is a larva, a maggot. And it normally would sit in this cavity here and then has a little breathing tube up to the skin surface. So when they're removed, if you excise that whole the larva with the encasing area of basically scar and granulation tissue and fibrosis all around here. So this is basically like a pseudocyst with a massive amount of inflammation and granulation tissue, which isn't coming into focus, but you can trust me, it's there even from low power. We see the shape of it. So that by itself, we would just say, well, it could be a ruptured cyst. It could be a lot of things, an abscess cavity, hidradenitis suppurativa, pilonidal sinus tract, all that stuff could look just like this here. But then here, there's a little bit of a little fragment with chitin in it, that yellowish refractile carbohydrate, the chitin right there. And then what's happened is that after this was removed, the botfly larva popped out. And it has, I don't know what the microanatomy is here, but I do feel like the microanatomy, even though the size is about right for a tick, it would have been coming from that cavity, whereas ticks are always up on the surface and only their mouth parts are in the skin. These guys are underneath the skin, down deep in the dermis, or even like in this case, in the subcutis probably. And they've got lots of muscle. All this is skeletal muscle here. And I do feel from a couple cases I've seen in recut collections that their pink and yellow chitin of their exoskeleton is very like wavy and undulating. And I think that makes sense if you just think of like a regular fly larva. They have like really bulging ridges on them. And I think that's my theory, is that that's what this is recapitulating. I've never actually seen a botfly larva in person. But I think that this really undulating look is kind of characteristic of the botflies that I've seen. And then again, you have these little nubs of pink or yellow chitin, and then a bunch of muscle, and whatever these weird things, these huge cells are here. I don't know what those are. Is that a breathing tubule there? I don't know. It's a mystery. If you're an entomologist, please let me know. And then, of course, the huge reaction. So that's the botfly.